Well, good morning, everybody, and welcome to this fourth conversation cafe for the Breathable Cities community of practice. We're very happy today because this is going to be the last cafe of this season, but it's a very special cafe because we have a very special guest. Her name is Ana Ortigoza. And before we go into the conversation with her, I want to let you know that Anna is an MD, PhD, MPH, and MS senior research scientist at Urban Health Collaborative in Drexel University, the United States. And she's also part of a network, the Urban Health in Latin America City, SALURBAL. And she has focused her research mostly on understanding how health inequalities among women and children are linked to social and built environment in cities. She's also interested in the connections between health and urban poverty and in the use of data for intelligent urban systems, making data and evidence more findable, shareable, and usable in a way that could empower grassroots organizations and inform decision makers to generate societal changes. Since the pandemic, she became a runner and she's planning to do her first half marathon in November 2021 in Philly Half Marathon. So her experience is very interesting for us because, as you know, the clean air zones and creating all these projects on air quality are very complex and they are immersed in very complex relations with sectors of the society, with situations. And so her approach, we found her approach very systemic to public health. It's not only just talking about the technical part of public health, but also all the complex relationships with how women face public health, how children face public health, how poor people face public health, and a lot of things. So I don't want to spoil the whole conversation with my excitement. I just want to ask Ana Ortigoza to present herself by sharing a little bit of her experience with public health and intersectionality, so we can start this conversation with her. And thank you very much, Ana. We are very happy to have you here.
Thank you, Jesus. Well, I don't know. Are you okay if I say Chu to you, or? Well,
Chu is great.
Sorry. Okay. Thank you so much. I'm now living in Philly, but I'm originally from Argentina, in Rosario. So, and I have been pediatrician for almost 10 years. So I feel like now in this position or in this role of researcher, I'm just, taking or a perspective that I have seen as a practitioner, in public hospitals, working in public hospitals with children, and with the mothers of those children, but beyond mothers, with women as well. And I think the issue of thinking, these problems in cities, it's that we need to bring it through the perspective of interdisciplinary or transdisciplinary and also complex system thinking, because there's no such a thing that you can intervene and that will change the whole spectrum of the problem. And mostly what happened is that one intervention in a city will make a several chain of changes, and that probably will bring some benefits, will bring some side effects or some unexpected effects. But mostly what we are intended also to think about is that when we do a little intervention, those interventions could be beneficial not for one population, but many groups that are, suffering some level of vulnerability in the society. So I think that's the interesting perspective of thinking this as a complex, unit, that everything that you change in a little spot could bring a big impact in another place,
That's very interesting. So we know that you have carried some studies on that, specifically the problems that air quality and air pollution affect public health and how different populations are affected differently from this intersectional perspective. Can you tell us more about that?
Yeah, let me explain a little bit about. I don't know if everyone is familiar with the SALURBAL project. SALURBAL is a project that means Salud Urbana in America Latina. It's urban health in Latin America. It's involving almost 370 cities across 11 countries. So the countries that we have in this pool of cities in this project are from Argentina, are all cities with 100,000 population or more, and they are from different settings like Argentina, Brazil, Chile, Colombia, Costa Rica, Guatemala, Mexico, El Salvador, Panama, and Peru, and Nicaragua. And what we usually do with this project is collecting data that it has been already there, like secondary data, let's say census data, health data, healthcare records in national health surveys or in vital statistic registries. We combine them with some data that was created ad hoc by some of part of the institutions that are part of this consortium related to built environment measures of the cities, and also we also collected or linked to this platform some data related to air pollution. But when we think about trying to understand the connection of air pollution, cities, and health, it's a really challenge because data is limited. And that's why I like that you included in my presentation that I'm interested in this idea of data systems and how we share data. We could look a little bit disconnected of other focus of interest, but it's really all about the same thing, because if you don't have data that is available at a large level of cities, as a broad level of units of analysis, you cannot measure impact, and you can also not inform. So that's why it's so important to start thinking about how we collect systematically in a broad range of cities or populations data related to the environment, data related to the social conditions of the population. And so, given all the limitations, I can talk more, afterwards if you're interested. We have done some studies, mostly looking at the impact of air pollution on child mortality and air pollution and the distribution of air pollutions in these cities.
That sounds very interesting, because I agree with what you said. Where if we don't have data, clear data, accessible to everybody and representing everybody, it's very difficult to take decisions. About that, how is it that we can communicate this scientific data in a way that civil society, and particularly those most affected by these so-called corrective actions sometimes, are, I mean, how can we do some, how can we use this data in order to understand all these differences in population? Because public health is not a simple issue. It's not just about there's pollution, it's going to get sick. No, some of them are going to get even more sick than others. And some of them are not going to be affected because they live in different areas that are not being affected by the air quality issues. How is it that we can use data for that?
Yeah, well, so there are many aspects of data, right? We mostly do quantitative analysis, so we are measuring in a very quantitative way how this can be, measure and scalable in terms of impact. But there are many other, ways of trying to address this issue, through qualitative analysis and interviews, which I think are enriching the gaps that quantitative data cannot, and also shows other perspectives of the problem. From the kind of research we are doing, I think the most challenging thing is showing that even with imperfect data, we can see some evidence or some results that could be informative. But the idea of communicating these results, it's that we can engage also the community and the stakeholders, and maybe also, grassroots organizations, because these are sometimes the people that it's moving, from bottom up actions that could be, sustainable and scalable. And in that sense, I think these kind of conversations, that as the one we are having, are helpful to digest a little bit the academic language, and trying to bring it to a more plain and understandable way of communicating. You were asking me, I think I didn't reply to your previous question. So what we have done, for example, in terms of looking at some impacts of air pollution, we have seen, one of the studies I have carried out was looking at levels of PM 2.5. So one aspect of air pollution in each of these cities across 6 years, from 2010 to 2015, and we show how the changes in the level of air pollution over time were related with the changes of the levels of under 5 mortality in these cities, and they were somehow related. So increasing in the level of air pollution were associated, independent of other factors that we consider as associated with infant mortality or under 5 mortality. Independent of those considerations, they were a kind of association somehow, So there was a kind of connection between how varies, or how goes up or down the levels of air pollution, and that was also correlated with how much or less levels of under 5 mortality were. And that makes us think how this intervening in different ways. It's probably that we are talking about air pollution, but we need to differentiate in ambient air pollution. So the pollution that is in the air we're breathing outdoors, from the one that we have at home, because that's another concern. There are many places that are lack of ventilations, and children and women are mostly staying at home, and those make them more vulnerable to also indoor pollution and outdoor pollution. And then we think, we have seen this in a very general or broad way, so we couldn't differentiate whether this is affecting more some populations than others in the cities. We just saw that, overall, increasing in air pollutions were correlated with increasing in under 5 mortality. But then you think, well, maybe this is, as you mentioned, this is not affecting at all equally, because if you have a house, for example, that you can afford a ventilation system in your home, or or you work in a place, or you live in a place that is near to green spaces areas, well, you are more probably in a better position to handle or mitigate the effect of air pollution, or your exposure to air pollution. And in this concern, it's interesting, the topic you brought in this conversation, that it's the intersection of poverty, gender, and cities, because we know that in Latin America, and I guess in other regions like Southeast Asia or in India, the greatest proportion of the population that is in poverty and living in urban areas are women and children. So probably, if we think in overall population, and even if air pollution is spread around the city in the same way, these people is more vulnerable, because they have also socioeconomic conditions that are making them more vulnerable, or more exposed to spend long hours in an ambient that is polluted. And it's not only polluted by air, but also by soil, by water. So, and they are maybe already having, susceptibility because they are already sick, or they have underlying conditions that make them also more vulnerable to the exposure. So there are a combination of individual and contextual factors that make them more vulnerable or more susceptible, even if we have levels of air pollution that could be, equally distributed. Let's say, when we can discuss that, but let's say that there is not a compartmental thing, that ambient air pollution is affecting one block and not another next one. It's more a kind of smooth thing. But there are some things related to the social context and the individual context that make them more susceptibility.
That's a very interesting and intricate situation. We've heard in the previous conversation also that women are especially affected with air pollution because they use the transportation during the day more because they have to commute and they have to go back and forth to the markets. Also, that most of the people in informal business or street business are women, and and that affects obviously the children. So I think I mean I would think like in a common sense or like a very logical way to do that would be to consider, for example, these activities into the design of cleaner zones or um, integrating bike lanes or different ways of means of transportation for these sectors of society. Are there any other stories or practices or situations that you know about or that you have
Yeah.
participated in about that?
Yeah, well, so as part of our project, we don't work with primary data, or we are not doing interventions, but there are many initiatives in Latin America that are working, to change in the built environment. Because I need to start saying that, at least in Latin America, but I guess in many other cities of the global South, cities are not prepared by women and by children for children. Are not prepared, are not designed for women's activities and for children's activity. We need to consider also how the gender roles are so clearly separated in these cultures where women are also carrying all the burden of the care and the non remunerative work, and this is also something that you do in your nearest context of where you live. So for example, if we have populations, we already said that most of the proportion of the poor population in cities are women and children, and these women and children are also living in poor conditions, and they are working nearby or living doing all the activities in the same area that they live, which sometimes is not the case for men, or there are some other women we know working in domestic work that they may do some travels to other areas of the city, but mostly informal workers working on the street, as you mentioned, in markets. They are working nearby the same place they lived, and so they are always in this exposed to this kind of context, politic context. And the initiatives, some initiatives that have been, and this is the idea of thinking, combining this idea of complex systems and how we change one thing with the intention to target some population and it's co-benefiting other populations. There are some recent examples. I think you may be familiar with Urban 95. Urban 95 is a project in some cities in Latin America that it is funded by Bernard Van Leer Foundation, and they have done, for example, in Bogota and also in Lima, they have done some interventions in the built environment, so in the streets, making some routes for children to go to school safe, like safe in the sense of traffic safe. They have implemented, closing roads, or also, beautifying the streets and the sidewalks where the children mostly do, they wait to schools. But this has been also having other effects that were not intended at the beginning, like, well, if it's safest for children, it's also a nice place for women to walk and to gather, because they feel like there is no risk of being robbed or rape, whatever. And this also was because of accessibility, allowing accessibility to children that they need to walk, to toddlers that maybe are needs different conditions of the sidewalk and so on the streets to walk, was also good for elder people. So this idea that you are targeting an intention that is good for one sector, it's maybe also benefiting other sectors of the population. It's an interesting idea how we can intervene, and maybe even if some of these interventions are now so cost effective or maybe now low cost, but they have a great impact as well. And so this creation of safe place for gathering and for connecting, I think have many implications. It's not only about, assuring or granted that you reduce, for example, traffic related injuries, but you are also allowing people to connect and generate a sense of community. And this, in the case of women, is so important because it's a startup, or it's a triggering process for empowerment. And maybe in the long term, we are also allowing some other impacts that are not measurable in the sense of injuries, or they may have long-term health consequences because of empowering processes that are not closely related to the intervention itself.
That's very interesting, Anna. I think we're facing very complex situations in which we are not able to, if we are not taking our times to map out these relationships and to understand all these complexities we face, we may be, as you say, instead of you benefiting one part of the population and co-benefiting the other, we may be just benefiting one with that is already probably in privilege and affecting the others or making it worse for the others. Also, there's this situation about because poverty, when we talk about poverty and pollution in the cities and public health, it's when we talk about public space, we know that most of the things that have, like for example, here in my city, in Mexico City, we have bike lanes and spaces in rich areas most of the time, but we forget about the outer areas of the city, or the less the poorer rich areas of the city. And sometimes the connection between these areas, because people move around, it's inefficient, and it's like trying just to move the pollution out of some areas, and that doesn't really work a lot very well. How can we change that through public policy? Is there, for example, something that we should consider in public policy that can help us?
Yeah, you know what? Oh, sorry. Sorry, I interrupted. I'm just so excited because I feel like so it's so simple to think, well, we need to reduce carbon emissions or from cars or from buses, and let's put more bicycles there were more bikes. But if we don't think about the context of how we use the city, like how women's use, or what are the things that enable women to participate more in the public space, those things will, it's like any intervention you do, like so massive, that it will going to benefit always the same that are receiving at first the benefits. I feel like, for example, if we want to encourage women to use a kind of transportation like bikes, because that will be more sustainable for them and for the cities, well, maybe we need to think first about safety, like reducing violence in public spaces, reducing or making spaces more safer somehow in terms of crime, because in any kind of use of the public space, women are getting a little bit behind because of these barriers or challenges related to feeling insecure, feeling that they can use some certain public spaces within certain hours and not others. And so maybe some first prompt for encouraging use of these ciclovías or bike lines maybe is granting that this space is safe, that they and also for children as well, because women, mostly mothers, are also very attached to children. So children's behavior is really attached to mothers' behavior somehow. So maybe this is, like how we improve, safe in cities, maybe not connected primary or very, very close to the idea of reducing our pollution. But if you start thinking like, well, maybe if you enable a safest environment, you install bikes, and then, women are using more bikes or using the street for walk, for using other means of transport as well. This is, changing the equation, but you have to think a lot on a more upstreaming factor than the immediate one that could its could it's related to the problem that we are thinking about. There is, I think, a study. I think it was. I'm not having on the top of my head the title, but it was run by Tiago Henrique de Sá, which has studied in some European cities what was the proportion of bikes that should be available in cities for women, for encouraging women to use them. And I think the ratio was 7. So when you have a proportion of 7 for 7 men using bikes, there were 1 woman using it. So you need to put a lot of more availability of bike lanes and bikes for allowing women to be encouraged and encourage the use of them, because I think one of the concerns in any public transportation is safety. So you can put them, but maybe not the way you are going to make women's use more that. Will be more men using that for transportation. And also, the other thing that you were saying related to the social conditions, that maybe these are implemented in the richest areas or the wealthier areas, and not in the poorest one, or the ones that are more in need. Well, I think it is also related to safety, because sometimes, we hear from some in some cities that you install these kind of share rides bikes or systems. They have a lot of infrastructure that you need to put, the stations, and then, because of violence, because there is a lot of street violence, they get, damaged or unusable, or they disappear in the infrastructure. So that's also, I think, to think about.
Yeah, it's something that we need to think about a lot of things in order to take a decision from the public policy and from the implementation of a project here. Let me take you back, because there is something that, we understand the situation with women, but you say that children's lives are attached to this situation, and we want to focus more on the children a little bit here and their health. With a question that came up here from Subadarsini. It says, what initiatives are taken after getting the study report on effect of air pollution on child mortality, specifically toward child's mortality?
So the first thing we are trying to advocate for is to have better measures, because this is something, if you don't quantify the problem, you cannot address it, So one of the things we are trying to use these results is for saying, well, this is a kind of not preliminary, but it's the first thing we can say. We cannot look more into. We were not able to disaggregate a little bit more to see which parts of the cities are vulnerable to under 5 mortality, because we don't have in many cities, ground-based monitors. So this study has been done with satellite monitors, but sometimes satellite monitors also, or these measures, satellite measures, need to be correlated or validated with ground measures that you take, from monitors that you have all the time in some places of the city. There is a challenge also in Latin America that in some cities, these monitors are placed in key areas of the city, which are the wealthier ones, or the most administrative relevant ones. And then sometimes you have them, but they are not taken in a good maintenance, so they are censoring 1 a day, or 2 times a day, or they are sensing the same thing because they are not having the maintenance that it's or the kind of filters that they need to be removed and replaced. So one of the things we are saying is from the beginning is, well, let's focus first on having better measures of air pollution, more measures of health, because when we talk about mortality, it's a kind of endpoint. It's, we would like to see more research on hospitalizations, or how many days children are not going to school because they have respiratory conditions that make them go to the hospital or remain at home. because that would be, the idea of thinking the real impact that maybe air pollution may have. But for these kind of things, we need to improve. We need to have more daily measures in many places, and also places that are near to the places where children are moving around in the city, or women's as well. And so this is something that we are advocating for, like having more information, more data for having, or better data for moving on, because then we could give a better scenario of what is the impact. And I think sometimes, I'm not in the political engagement piece of this evidence, but from what I have heard, talked with people that it's closest to stakeholders, sometimes to convince a person to change a policy or to make an intervention in a city, you need to show the real cost of this, the real impact of this. And sometimes the only way you convince a mayor or people in the government, it's about economic impact. And if you are showing, see, there are children, there are women that are not able to work, to go to work, to go to school because of air pollution is affecting their health. Well, maybe this is, even if it's a very economic driven point, we are trying to move forward to better health somehow.
Yeah, I get that part of it. I mean, talking about the economic things, it's always a very complex issue to talk about that. But you're right. I mean, we have to quantify what's the cost of doing nothing, or what's the cost of not having that data or this information. I'm thinking that probably schools can somehow be an important, like if you have monitors in schools, or you have things like, how can we then make these data creation or data recollection systems more, I don't know if distributed? I'm imagining something that can be distributed.
Yeah, it should be. We say with this group of people we are working on data systems. The data should be fair and fair. We say fair. It's findable. It's findable, accessible, usable, interoperable, and reusable. So the idea is that we need to know where to find the data. We were able, once we find the sources, to be able to retrieve and to download, let's say, or use it without so many complications, and then to make it usable in a way that we can compare with other places, like, let's say, cities in Latin America with cities in India, with cities in US. So to have a dimension of where is the problem, or how is the problem faced in different contexts. And then reusable, in the sense that we can improve it, but making them better available for next use. And the other thing is that should be cared. So it's also to be used in a way that could be community benefits, and also that could be making some that this information could give it back to the community where you are extracting somehow, or retrieving from, and make them a part of the decision making of the use of this data and the implications of this data. And I think this is the most challenging part in terms of cities, and I think this is the beauty also of working with data in cities, because cities are about the communities living in a very limited place. It's not about a nation, and they have that it's more extended and could be more diverse. But a city, even if within city we have a lot of inequalities and differences, it's a unit that has their own governance, and they can use some changes that could be sustainable, scalable, and more participative somehow.
Great. Yeah, it has to be. I like the idea of making data collection, and also the generation of all this information, making it more participative. Let me also bring a question from the chat. Can you tell us more about the tools and models that you use in order to assess health impact?
Yeah. So, well, this has been in. So, I think they are referring to this study that we did for studying the relationship between air pollution and under 5 mortality. Well, in this case, we have an ecological approach. Because we didn't have exposures for each individual in each city. We used average air pollution levels, annual average air pollution or PM 2.5 levels in the cities, and we showed the association that has with annual infant mortality, under 5 mortality rates. So it's more an ecological approach. We used multi-level models. So I don't know if they are asking about the statistical models or it's more about that detail. Let's see.
Yeah, I don't know if Carlos can probably expand that question. I imagine that it's more like understanding how did you come up with that, and
okay,
and how did you come up with the assessment of health impact related to that? Yeah,
we didn't do a health impact assessment. This was just a simpler, if it could be say simpler, statistical analysis or epidemiological study we did. We haven't done a health impact assessment.
But that's because, as you said, there is no baseline to start with. So what you have to start doing is to create that baseline to start moving from.
Yeah. Sometimes, yeah. This is, and there is other study that have been carried out by other researchers in SALURBAL that has to do with just describing, levels of PM 2.5. I can then share the publications. I don't have them at hand, but. Yeah. So it's just about sharing describing the levels of PM 2.5 in cities and trying to see, for example, the proportion of population under 5 or above 60 years of age living in those cities, and thinking in a very ecological manner how these levels of air pollution could be, affecting some population or women or males in different ways. So in this kind of study, we were able to characterize levels of air pollution in these 363 cities in Latin America and compare levels and try to see, also demographic characteristics of these cities and have some idea of how this will be affecting different proportions of the population. Let me see if I can.
Yeah, it would be great if you could share that with us, because I think sometimes it's important as we are opening. I'm talking about the global scientific community is opening a little bit more every day. To integrate different perspectives and to connect different sectors and sections of these situations that we face. We have to start creating baselines, and we have to start creating platforms to start researches from. So in that sense, this is very interesting because it's a relationship that we usually don't hear. I mean, the air population and children mortality is something that I understand that it's kind of emerging. The preoccupation is emerging, and I think it would be very valuable for the community to read it. So thank you for sharing the link in the chat.
I will put also the other one that it's about the infant mortality, the under 5 mortality. This is an abstract. The publication is coming soon. But okay. Yeah.
So while you share those, I want to start opening the invitation for, we have Mexican, Indian, and people from the UK. Okay. I have to open the invitation to start some, probably if they want to make a question directly to you.
Okay.
They want to come
I just wanted to add that, yes, particularly related to gender and air pollution, we haven't done yet studies, but we have, because also there is a challenge. It's not the challenge only of air pollution, but also to depicting gender disparities in our continent. In Latin America, it's very difficult to have measures across cities that you can depict gender inequalities or, women's empowerment or any kind of women's achievement. what we have done so far. It's trying to create some complex measures of some scores of gender inequality. We have reproduced a gender inequality index that has been mostly developed at country levels. We retrieved some census indicators that has been used nationally to create these indexes, and we made it the statistical calculation for cities. And so we are going to release this soon, and I look forward that maybe having some measures of gender inequality and also women's achievement. That means how good are women compared to other women, let's say in terms of education, in terms of labor force participation, and then we can also integrate this in the research of air pollution or susceptibility to exposure to ambient PM 2.5.
Yeah, thanks, Anna. That's very important. I'm opening the invitation for everybody to come open their camera and microphone if they wish to participate in the conversation and start making some questions. We have also a question from Subadarsini. How do you think we should convince governments implementing agencies when political interference or opinion differences are there? I'm not sure if we have a question for that. An answer?
So convince the government in the agency in terms of women's agency, right?
No, the implementation agencies. I'm thinking she's referring about the government offices that have the work or the chore to implement equality projects or public health projects.
That's also that's why I think this kind of matters are more bottom up than top down. So I don't see this is because this is so tied to the economic development, and this is not a problem only in the global south. It's also a problem. You can see, for example, here in the US, it's a big debate about some now that some bill that they are trying to put some money on governmental money on changing the infrastructure for how we use energy resources and trying to leave the fossil oils and use and use more non fossil oils sources. But this is interfering so much with economic interests, and so I think that trying to target this at the top of the government, it might be more impactful, but it will take a long way. And so, in the meantime, I don't think we need to abandon that idea. But I think in the meantime, I'm more confident to make changes from bottom up, and maybe empowering communities, achieving communities in these areas that could be more vulnerable. Women have a lot of power to move things, and there are so many examples of grassroots organizations created by women in slums or favelas in Brazil. You have a lot of movement there that if you are also can explain the complexity of this problem and try to see, well, we need your participation and your voice to move this on and put this in maybe the agenda of that council in that city. But if you do a change, then that this showing some positive impact, and maybe it's successful for some couple of years, that could be replicated in the next by city, and that maybe start scaling up. I think these kind of conversations where we are integrating many cities and we are getting together, at least in this community of stakeholders, researchers, we are also contributing to that change. But I think I really fervently believe that this change might be a pressure from bottom up, because if you are trying to it will be it will be the way of trying to see how circular economies, which are also sometimes move on or impulsed by women, that could make a change, maybe in a neighborhood, maybe in a favela, or and then from that on, scaling up. Yeah, it will take many years. Yeah, probably. But the thing is, it's not coming back, because you see Paris Agreement. Well, it was a very nice agreement, very lot of broad lot of countries there, but we didn't push. We didn't move so far the needle to any change.
Yeah.
But maybe this take more time. Yeah, take more time, but we don't go back. And so I think that this idea of progress has to be maybe little steps, but the steps that we take, that we don't go back 2 steps back, or
Also, I agree totally with you. I think going from bottom up in a way that how is it that the top, if we see a hierarchic organization, how is it the top it's going to know what to do in terms of public policy, for example, or implementing projects, government projects? How are they going to know exactly what needs to happen if we're not listening to the ones at the bottom, to the ones that are going to use the space, to the ones that are transiting? And in that sense, that's why it is interesting to see how there are many. And yesterday I was in a conversation, and that was exactly the discussion between government officials and other people that saying, like, they wanted to do some public policy, and they say, like, well, yeah, but you have to start making piloting of projects in the local thing, on the ground, so you can get the information and you can get the experience then to sustain the creation of that public policy. So it's very interesting the way that
I think this is a problem of agendas, of how we handle agendas. I have a research agenda. My goal is, probably do some evidence that could be relevant, but I have my own agenda. Maybe the communities have, their own agendas, let's say, because they need to live day by day, and maybe they are more, now focused on getting the food for, dinner tonight, and not thinking on this. And the government or political stakeholders, they have their own agenda, the agenda of winning the next elections, and so we need to somehow come to a narrative that could gather, I think, communities in claiming this in the same way they claim, because they are the votes that are going to make place the stakeholders or not in the positions that they want to be. So the way of moving the agenda, I think it's from bottom up, because if we don't install this as a demand in the population, I don't see how this could be heard loudly in the political community, or in the political establishment, that it's concerned about winning elections and short-term goals, and an agenda that is the problem here is a problem of agendas, I feel.
That's very true. I think too. I think so too.
And I'm telling this on my own, right? I'm not representing with this speech anyone. It's my belief, and I assume my responsibility. Yeah. Okay. No, I don't want to have conflicts on interest, but this is the truth. The truth is about agenda.
Yeah. So this is great, and thank you for sharing all your experience. And I would like to ask the people from UK, the people from Mexico, and the people from India, if they want to come on and say something, probably share also your perspectives. Mark, I see you have opened your microphone. Welcome, Mark.
Yeah, hello. Hi, Anna.
Hi.
And really interesting to hear what you have to say. You reminded me of, I was lucky to go to a meeting in Ulaanbaatar in Mongolia, and there was an initiative there where women were encouraged to wear face masks during pregnancy to protect their babies. So I was kind of a bit unsure, because I think we should be dealing with the problem of the pollution, not expecting the ladies who have no power to change the fuel policy to deal with the problem, but also they're in the situation that they're in, and so it was important for those individuals and their families that maybe that's something they could do. What's your view about those kind of that tension between asking poor women to sweep up the problems that everybody else is causing?
Yeah. Yeah, that's true. I think that sometimes we also burden, some vulnerable communities that are struggling with everyday things to also, it seems like it's imposing, well, you need also to take care of this. I feel like we need to come up with some kind of narrative that could engage both things. Is that like you're not, your environment, your needs are not going to improve unless, and this is not about stay problem. It's our problem, but we need to all, I think move on the same direction. And this is also another aspects of cities, that we sometimes tend to think, well, this is because of poverty in cities, so it's a problem for the poor. But we have demonstrated, and also I think that this pandemic have demonstrated that this is not a sectoral problem. This is the poor or the level of poverty in a city is impacting everyone, even the wealthier ones. So in the same way, inequalities in women, we have done some studies we haven't published yet, but we have demonstrated that when you make women participate in labor force, it's also beneficial for men. You right. See that there is more impactful change or reducing mortality, men's mortality in Latin America, when there are also a more participation of women in the labor force. So because you improve the economy, you improve household income. So there are things that we don't think in terms of, well, this is a problem of women, this is a problem of poor. We need to think in terms of we improve the conditions of the poor in the city, and the whole city will also thrive.
Will benefit. Yeah, and some of our work we're doing in Asia right now, we have a specific target for involving women in in stakeholder engagement groups. Some cities that's really easy, and in some cities it's really hard. That it seems like I guess historically men have had the education and they have the power, and it's difficult to find people who are willing and have the time and the ability and to participate. But I think things are improving, maybe.
Well, because that's also the complexity of women. This is the same. Well, let's empower, or let's make women more participating in. Well, but you need to relieve them from household duties, or do something, because they have a limited time as well. So, otherwise you are burdening them with another load of. So that's how those things are very connected. You see childcare. Well, you may not think childcare could have an impact on air pollution, but maybe if you allow childcare, you allow women to think other things that childcare, and then can participate more in civil things that are concerning to the environment. So I think things related to gender equity are also impacting in other sectors of health and the economy.
Great, thank you very much.
Thank you very much, Mark, for coming on stage with us. And I don't know if anyone else has another question or comment to make. Probably. Sudhadarsini, come on, join us. Hi.
Good evening from India.
Hi.
Hi, Anna.
Nice to meet you.
I don't have any question. I just want to share something with you. As a from a developing country, from India, the topic today is like the gender and the poverty. The thing is that when you mix the gender with the poverty, they don't understand, and they prioritize the air pollution in their lifestyle or in their day-to-day activities. I think it is the responsibility of us, like the people like us who are making guidelines and making acts and laws and implementing certain things. So it is our duty and responsibility that we should think about the air quality for them, because they don't need air quality at that first step. Because a poor first need a healthy meal, not a meal. It is not also a healthy. A poor need a meal, a cloth or shelter, and a gender like that women. In my country, gender the women still are in the backside of at every aspect. So they need their recognition, their identity. So at that places, the air pollution don't count anything for them. But being the engineers or scientists or activities who we are working for good air quality for our city, for our country, for our earth. So it is my opinion that we should come forward and take steps so that they can live in a better environment, in a clean air. And other aspects we should also we should take care of, like what I said, that what is priority for them. So we need some guidelines and initiatives, and they should be a little bit eye-catching. That with their basic needs, they also feel that government or different agencies or NGOs or different service providers, they are thinking about them, so that they feel important. That's it I want to say. And all the best for the half marathon you are going to organize in November.
Thank you. Yeah, I agree with you. I think it's important also to have guidelines, because otherwise you cannot, contrast and say, well, see, we are out of, or we are off of this, measures that are considered healthier, but yeah, I think that's a way of, it's also road to construct, right? We are sometimes, I don't know your experience, but from what I know from Latin America, sometimes it's really difficult to achieve.
Yes.
Thank you very much.
I also like to congratulate Jesus and the whole Hevas team, Emma and Monica, for successfully conducting the event on 14th October. I am little bit delayed, but I would like to take this opportunity to congratulate the whole team. Very beautifully organized it, and it was, and I am happy that I was part of it. Once again, many congratulations, and I hope to see you in such platforms in future also.
Sure. Thank you very much to Baratini. We are very happy that you were part of this too. So thank you very much.
Thank you so much.
We're actually getting to the end of the conversation, Anna, and we are actually very excited about all the things we heard, because I think that for us, or at least for me, it has opened up a new perspective. And I started with my systems thinking, training, and background. I started thinking about cycles that I can start mapping to show how all these situations that you just explained, and the intersectionality that we're not considering in most of the times and in most of the projects for urban sustainability, how can I map them to start putting there? But that's a work that I'm going to take with me. And thank you for that inspiration. And we thank you very much for the time that you have given us.
Thank you. I'm grateful for having this moment to have a conversation with you. I think this interchange of ideas is always enriching for all of the parts intervening in this, and I'm certainly that this will, inspire us to do something better where we are.
Great. Yes, I hope so too. And thank you everybody else for being here with us in this conversation cafe with Ana Ortigoza from SALURBAL and Drexel University. And enjoy the rest of your nights, evenings, afternoons, and days. Mm-hmm. Goodbye.
Bye, everyone.
Bye, everybody. And
bye, everybody.